Welcome to HERcast with Dr. Chito, where knowledge meets power and women rise. Today, we're tackling one of the biggest buzzwords in health right now, weight loss injections. From Ozempic to Mounjaro, these miracle meds are trending hard. But before you take the jab, there's a lot every woman should know. Because real results come not just from the shot, but from smart, sustainable choices. Joining me is the incredible Jocelyn Lee, a board certified family nurse practitioner with 16 plus years of experience across top tier institutions like Stanford Healthcare and the NIH. She's cared for everyone from transplant patients to even here taking care of international diplomats, and recently launched a nonprofit bringing care to underserved regions in Africa. Now she's part of our tribe. She serves as a wellness consultant at Arabella Women's Health and Wellness here at Tabitha Medical Center, working alongside me to help women thrive with holistic preventive care. So grab your tea, sis. This one is real, raw, and right on time. Let's talk before the jab. Welcome, Justin.
Thank you so
I've
much.
always wanted to come and join me here so we can talk about this topic, which is so important because as much as Ozempic or Mounjaro is effective in what they do, not only in treating diabetes, but also now people using it for weight loss. But there are a lot of things that people don't know about it. So I just said we have that conversation. We have it all the time in the hospital or in the center. So having that here now, I think will be really great.
Yeah, thank you.
What do you think?
Yes, I think it's a great medication. There's a lot of good things about it. I mean, there's definitely shown to have effect for weight loss, which is why it's been trending, up to 15% to 20% weight loss. But what we really want to tell people is how much that needs to be paired alongside healthy lifestyle choices that go along with it. Because you take these medications and you know that with every medication, there's side effects. You can't just do these without knowing what those are, but also there's contraindications. So there are certain things that I always screen all my patients before they get the injection because I need to know they don't have certain things which are highly contraindicated. And additionally, even though there are the advantages, you have that for such a long time when you're on these injections, but what happens when you don't have them? When you can't, or
kind of
it's
expensive.
It's very
in
expensive.
most places in Nigeria, it's expensive.
It's expensive everywhere.
And US,
if covered insurance, whatever it is. But even if it comes down the road that you decide I don't want to be doing this all the time, you have to think, okay, the point of these is really to help those who are in a great BMI, because it is physically and medically important to lose that weight for your health. But once you get that going, the most important is building these healthy habits.
And just for our viewers, BMI is body mass index, where we take your weight and then we take your height and then we calculate what your body mass index is, and we have certain numbers. So when you're above 30, you're considered obese. But when you're above 25 to 29, 25
overweight.
to 29 is overweight.
I believe overweight.
But I think for most of these drugs, you have to, one of the recommendations is BMI over 30, if I'm thought of. But let's start asking. I have this set of questions I want us to talk about so that people kind of get the vibe. Now, is Ozempic or Mounjaro the magic fix or just a shortcut that also may have side effects?
So there's never really, I think, a magic fix, to be honest.
There's no, and please listen, for those trying to lose weight, there's no magic fix. None. As much as you wish it.
Yeah, and I think the most important is really these healthy lifestyle choices you build, and it's never too late. But these are the things that become routine for you, that you are investing in your future and in your life from here on out. So, when you get older, it's harder to do all these things.
It is.
So do it now, because really when that time comes, all these, medical problems happen and it might be too late, and all of that is difficult. So I think, no, it's not a magic thing. It definitely is helpful in certain situations. We use them for diabetes and they're great drugs. And there are side effects. So any medication has side effects.
Sometimes when patients want to go on Ozempic, we talk about the fact that it could cause nausea, it can cause some tiredness. Most importantly, one of the things you always say to them though is, if you stop the medication and you haven't added some smart lifestyle choices, you will add the weight all back again, because there's work.
So it's like an addition. Think of it as something if you need help. But for those in really acute cases where okay, you need that because your health is detrimental. Same with diabetes. We do all of those things to get you started, and then we really pair it with lifestyle changes. Yes. But I do think it's very important to know that when we're talking about side effects, somebody who is maybe childbearing or thinking about being pregnant, like these things are also important because it takes the efficacy out of certain drugs, meaning like if you're taking a birth control pill, for example, alongside with these injections, it can actually decrease the effectiveness of that birth control pill. Yeah. So things like this that you have to know, you just don't do it on your own. You got to think about what other things are necessary when you're starting it. So
yeah. As I was preparing, I saw a study that was in JAMA in 2022 that found that individuals regain 2/3 of their lost weight within a year of stopping semaglutide. So these drugs, Ozempic is also called semaglutide as well. And if they did not maintain their diet and their exercise routines, right, then they will regain their weight back. 2/3 will regain
sometimes
their
even
weight
all.
back.
Yeah, it really is. It depends.
So, I mean, that studies, this is JAMA is a really well-known journal. So I want to believe people believe this, and this is very important. And I say this because a lot of people come to me and they're not even BMI of 30.
Yeah.
So, and they're taking Ozempic. They don't have any of those, what we use in the US as criteria, but they take it anyways because, it's not it's not over the counter, but you don't necessarily need a prescription for it here. So they take it and, oh, I just added a little bit of weight. I want to take this for a month. It doesn't work that way. And they need to know that taking any of these drugs as a long-term thing, number one, but you have to be able to maintain your loss. You have to make sure that it's a lifestyle. The next question I have that I saw was, are we trading long-term health for fast results with the weight loss injections? We know that, yes, people use it for diabetes long-term if that's what works. But in terms of weight loss, I want to emphasize, we're talking about Ozempic and Mounjaro, not about diabetes. We're focusing on it being used for weight loss. Now, are there long-term health effects? Are we trading this like this?
Yeah, so, there are things that we need to take a look at when using these long-term. Yeah. One is if you're not working alongside a healthcare provider to really guide you, you may use it as a crutch. You use it as a dependency, and it becomes this mental thing that, I can just use this and I'll be fine without making other changes. You feel maybe, if I don't use this injection, I'm not losing weight. I can't eat the things I want to do. Second, there's actually been recent studies showing there's muscle loss, and the reason being, or muscle wasting, is because you're burning that fat or you're losing that weight, but you're not filling that with muscle, in a sense, exercise. Yeah, so that's why we really emphasize how important it is to also exercise when you're on these. You're basically doing, like we said, the healthy lifestyle choices. So to avoid the muscle wasting, which is a big thing, you need to work out, get the amount of protein. And another thing is, oftentimes these medications cause you to have what we call satiety. So you feel full really quickly. But the problem with that is maybe sometimes you feel like, I just don't eat the whole day, or I don't eat maybe something small and that's it for the whole day. But it's also, you have to train yourself to think about eating smaller meals, but healthy, smart choices. In the meals. Because if you don't get the protein you need in that day, there's the muscle wasting. If you're not eating those small, like vegetables, fruits, and mixing that every day, you're still not getting that nutrition that you need for your body. So these are things that definitely can cause, long-term problems if you're not thinking about it right.
So I want to emphasize something you said now, that under the supervision of a medical personnel trained supervising. So I think that's something that's very important. Like I mentioned, people can get this over the counter literally here. So, and bypass being supervised by a health professional trained to do this. And so in my mind, because they'll say, I can get it from, and they're health professionals, but by someone that can consistently follow you up. Why is that really important? Because you said that, and I really want people to understand that it's a drug that needs you to do the injections
Mm-hmm.
under supervision.
Yeah.
But why do we insist on this?
Yeah, well, there's, I mean, things we haven't even talked about yet, but things that can be really scary with these drugs, such as pancreatitis or gallbladder issues. A lot of these things that we need to know. And I think if you're not a medical person, or maybe you are and you're not familiar with these medications, you don't think about that. And so you're not aware and you're not looking out for those things that really need to be tracked, because there are contraindications if things happen, you stop, or you need to know. Alongside with figuring out, okay, is it effective? You know, is this dose change good?
Yes.
Do I keep it on this dose? All these things are things you have to know about the medication itself. But most importantly is following them through that journey of, okay, again, we've talked about this. You are pairing it because you're trying to learn how to do these lifestyle changes. Because this is not a cure, right? It's not something that we just use for the rest of our lives and think, oh, I'm just gonna not eat food. I can eat whatever I want, or I just don't feel hungry, I'm not gonna eat anymore. You know, there's other things to look at that are part of the health system that we don't really talk about. So, and they all have an effect on it. Vitamin D, bone, nutrition deficiencies, all those things, which is why I also draw labs before.
Yes, because we always do, and that's the thing. You have to do some blood tests before you get on these drugs. I'd like to emphasize those things because I want them to hear why it's really important to be under the supervision. Because if most times in this climb, if some people have their way of just doing it on their own, they would. Maybe it's more convenient. I don't want to go into the hospital. But you have to know, if you choose this drugs, you have to be supervised.
And also depending on your time in life, right? So, you know, hormones change all the time. You know, and you know that. So even in that stage in life for anybody, your prime time, or if you're younger, your childbearing age, like you need to, so some of these medications you actually need to stop 2 months prior to if you're thinking about being pregnant. If you don't know that and you think, oh, I'll just stop and then I'll go ahead, there could be difficulties. So, you know, all these things are really important.
Are very important. And then there's something we need to talk about too is psychological dependence. You know, I'm very big on the mind and psychology, and very many times, you know, it's easy. I had someone that said, oh, I want to try Mounjaro. I like it. And I said, okay. And then how about X? No, I don't work out. I'm like, huh? You want to try Mounjaro? I say, yes, that's why I want to even to try it. I just want to lose weight. You know, I don't really like working out. I'm like, they come together. You know what I mean? They're paired together. And almost like, oh, you know, that, you know, I lost weight before, and when I added a little bit, I just went to get Mounjaro. I started seeing what I term psychological dependence, like using these injections like a crutch, and there's a danger to it. What do you think?
Yeah, I mean, I definitely think that it shouldn't be looked at it that way. These are in itself medications still. They carry different things. There haven't been very long-term studies on these injections. They came out, I think the first one was maybe 20 years ago, but that wasn't used for weight loss. They were for diabetes. And now that the injections are so popular, you know, again, it's everything's kind of we're learning about. But aside from that, it's that thinking of, you know, what type of things do you want to actually build as a foundation for your life? You know, these things that will steer you for the rest of your future and make these healthy choices and not be dependent on something. I think being dependent on anything, right, you could be let down. So again, what happens if for some reason the price of this goes really high, or whatever it is, we find out it can't be used. I don't know what the reason would be, but then you're back in this place where either you're back from where you were or worse, or I don't know, you know, so you have to think of it in that way of, you know, this is something to help us, but not dependent on. And just be, oh, I'm going to put everything else aside and be like, oh, it's an easy way. I don't think there ever really has been any easy way of things.
There's no easy way. Trust me.
No.
There's no easy way.
You'll learn it the hard way eventually.
And, you know, one of the things also I always tell patients is to we counsel, because when it becomes you're so dependent on, or you're seeing your body image is distorted, and you're using these drugs based on that distortion. So you're seeing what we're not seeing in you, and you think, okay, I just had a little weight. I heard about Mounjaro because you can afford it. You get it. One of the things you go through is counseling. You have to change the way your mind is thinking, because mental health is also part of healthy lifestyle. Or attaining good mental health is part of lifestyle. When it comes to what we eat, when it comes to exercise, when it comes to things like sleep, self-care, talk about that a bit, because I want them to also have the knowledge of what to do with Ozempic. Because we'll be saying exercise and diet, but if you can emphasize some things that you do, and then how you create the plans and stuff.
Yeah, so usually I work with every individual, and I know everybody is very different. So that's one thing I have to take in consideration, because not one person will do things the same as the other.
Yeah.
But I always try to incorporate where they're at. So if they're never exercised before, we're not just going to start, full force, but getting in that type of exercise, building the muscle, doing all those things is key. That should be something instilled in everybody's life, no matter what. That's going to be harder, again, like I said, in the future, your bones get weaker. So building it now is going to help you. Nutrition is huge. So, I've counseled a lot of people with this too. And for some reason, I found with vegetables is something very difficult to incorporate here. But there's so much nutrient in there, vitamin A, C, all these different things that is also necessary to incorporate. And so it's not just about, okay, I'm getting some food in, but what types of food? Right, that need to be a well-rounded meal. You need certain servings.
We like
of everything.
our carbohydrates.
I know.
And I think everything has carbohydrate in our food. We also have soups that have a lot of vegetables as well, but we love.
Yeah, and there's nothing wrong. We need carbohydrates, but it's about how to portion those so you're getting everything well-rounded, because your body needs that. I mean, that there are things like multivitamins.
Yes.
The reason is because we don't get it all. But really, I actually don't push multivitamins as much, because I think if you can get it in what you're eating, it's the best source, right?
Yes.
So there's that. Sleep. So sleep, I'm on this with everybody.
I know.
Sleep is really important. Think about it as a battery. You recharge, right? If you don't get good recharging through the night, you're not going to be effective, and you do have sleep debt. So if for some reason you are short, you're averaging 4 to 5 hours, that's not good. Everybody needs about 7 to 9 hours of sleep. So I help patients with finding ways to adapt their sleep and wind down routine so that they can actually get the adequate sleep. Because without all of that,
put your TV off.
Without all of that, really, it's
put your phone down.
Yeah, put your phone down. Your mental health, your nutrition, your energy is all affected by your sleep. So that is also equally important. I mean, there's a lot of lifestyle things that are incorporated into it, and it's just to be your best self, right?
Yeah. A lot of people are coming with disturbance of sleep. I remember when someone talked about sleep, and you mentioned 7 to 9 hours, and everybody like, how? Yeah. Like personally, I think for me, once the kids are down, like sleeping, is when I can now face my work and say, quiet, nobody's entering me, I'm not hearing any mommy or anything. I can just face my work and do a lot of the work I couldn't do during the day, because in the day, in the office, they're distracting me. At home, the kids are distracting me, and now I can do my work, and time flies. So it could be 8 p.m. and the next minute you're saying 12 a.m.
Yeah.
So sleep, I know for me is a struggle to get 7 hours. Oh my God, on a weeknight.
Yep.
It might be hard. But I mean, I know you said about routines. For other people that we're seeing sleep, and we're generally tired during the day.
Yep.
How do we fix it though?
Yeah. So
for us that have this kind of routine.
Yeah. So aside from working hard to at least get the deep sleep that you have, because there's different cycles in sleep, right? So all those different cycles actually recharge different parts of your system and the body, health-wise. And so if you're only really getting 4 and 5 because you just can't, right? Your lifestyle can't, then I would suggest, okay, let's see how we can fit in a small nap in the day. Something so that you can recharge a little bit. So there's different ways to work. If you're a night person, I say that's fine. You can sleep at 12, but see if you can extend it a little bit to 6 a.m.
Yes.
Work on getting more. Or if you sleep at 1 a.m., go until if you can do 7. Just finding those little changes so that it can work. I know it's hard with kids because I have them myself.
I know.
But that's something I really harbored with every one of my kids too. I was like, this is your bedtime. This is my time. I sleep. Because it's really important, and really just making that as a priority because it fuels your day. It fuels the rest of everything you do.
And your kids are actually learning from it.
Yes.
To build it into their lifestyle.
Yeah.
That is a time, like my mom sleeps at this time. So many things that we do that we don't even realize that kids learn our habits, good or bad habits.
Yeah.
So your kids, when you say your kid, I'm like, they're learning so much good from it. Yeah. Now going back to the Ozempic Mounjaro, I'm sure people are curious. How does it really work? Some people will hear this and like, okay, weight loss injections. Okay, and how does this work? You know, how do these weight loss injections make them or a patient lose weight?
Yeah, so it's a GLP-1s is what
Yes,
these type of drugs are.
GLP-1,
Yeah, they work on basically increasing the insulin sensitivity. It helps out. So it started out as a diabetic drug.
Yes.
And what they found out that it made people more what we call, like I said earlier, the satiety. So you're full, you feel full longer. And so people's appetite kind of goes down a bit. But it also works on helping their insulin and glucose pathways work better. So in a sense, your insulin is more sensitive. You know, you release that when you need to, when the sugar comes in versus staying there for a long time. So the mechanism of how these work is really, in a sense, that way, targeting the pancreas, but also targeting different things in the body to help with building that either fullness or helping your insulin become more effective.
What patients feel is mostly the decreased appetite.
Yeah.
And then they don't get to eat as much.
Yep.
But you remember she mentioned that even if you feel that way, we should still eat.
Yeah.
But eat the right
things, smaller portions. You know, to lose weight, you do have to eat a little bit less than what you're using if you're not exercising the exact amount of calories that you're putting in. So it's, you know, a combination of all these things that you have to take in consideration. But yes, it's important. So some people think, oh, I'm losing weight. And this is to talk about the muscle wasting too. It's like, oh, I'm fine. I don't have to do anything. But it doesn't work by taking away weight and then not building the muscle you need. It's just kind of a mechanism in that sense. So it's important to think about all of those to help with the medication itself.
All right. I just want us to be very specific about something. Many times before we start Ozempic or Mounjaro, we have to do certain tests and we have to do assessments as well. Let's elaborate on what we do, because it's important that they know why I said that you must be supervised. You must see a health worker first before you go into it. And when I say health worker, I'm trying to cover, you know, different specialties like doctors versus nurse practitioners and all that. They have to be trained. And a lot of both doctors and nurse practitioners and nurses do this, but they have to be trained and understand the drug in itself. So you have to do your homework. So what kind of tests or assessments do we do or need to do before starting, just in terms of explaining why it's important? You can do them outside, but we need to interpret them and all that. So what they do.
So I actually go through a very full kind of assessment in a sense, starting from medications you're taking to what kind of has been going on in your life with weight loss, or what have been, you know, some diet things that you have done. So seeing their journey, because it's a plan that I create really individualized for each person. Because I think using these medications, like I said earlier, is not just going to be one size fits all. So it really is something that I look into with each patient. Aside from that, I always do blood tests, kidney, liver, checking both of those things because prior to starting the medication, as well as also going through history. So, you know, contraindications of thyroid issues, which means you can't use it, different things like that that may appear. Additionally, just kind of what is their outlook on this? You know, what is it that they're trying to gain out of it? The mental health piece.
Yes.
So, you know, do you have body dysmorphia, body image kind of changes? What is your goal for this? Because that also helps me understand where they're thinking they're going to go with this, and if there's alternative ways to go about it. There's also studies that have shown, you know, there can be changes because with any drugs, there's the mental health aspect. You know, if you have severe depression, anxiety, things like that, we also need to watch out for. So it can exacerbate some of these things. It's really important that you get that full assessment to know what medications you're taking, like I said, because some of them get less effective if you take them together, things like that.
The important things that you need to do before you start these injections. People ask sometimes, what do I choose? Should I choose Ozempic? Should I choose Mounjaro? I don't want anybody coming after me. So, but what we'll say is...
Yeah, so there are two very main popular ones for now that you guys have heard of. Their generic names are semaglutide and tirzepatide. But both of those, you know, there's different they're effective in different ways. So they're not the same type of drugs. They're both GLP-1s, but research has shown, a certain one is more effective towards somebody who has cardiovascular disease. So if I'm taking their history and they have things that may come up to me as, blood pressure or heart failure, or anything that is having to do with that, I would choose one over the other. I also take in consideration the dosing, the effectiveness, pricing, all of those things that come in consideration. But really, these drugs each have their own kind of specifics as well.
Yeah.
So,
I mean, each drug will always have its pros and cons. And as health practitioners, we always will look at your individual unique history to choose the one that's best for you. So that all comes with when they're counseling, I guess, when they come to you for consultation. Amazing. You guys have heard a lot about Ozempic and Mounjaro. It is trending. But one thing that was very important was for us to bring this to you today, so you listen for all the information you need before the jab. Do you have something you want to say to them finally?
Yeah, I think, in all, this is something that is going to be prevalent. It is a great medication in the sense that there's a lot of good benefits to it, but really just know that it's not a cure-all, right? We need to know that there are a lot of things that go on with every medication. So make that smart choice of reaching out to a provider first and discussing that with them, having that conversation about, okay, what is it that I'm looking for? How is this tailored to my specific needs with my different ailments that I have, in my personal health record? Because it's necessary that we figure all those things out because it can affect it. So.
Yeah, I always tell people you're unique.
Yeah.
So your health journey is unique and your plans for you is unique. Wow, what a powerful and necessary conversation. As we've learned today, Ozempic and Mounjaro can be effective tools on the journey to better health, but they are just tools, not shortcuts. Real transformation happens when we pair knowledge with intention, nourishing our bodies with healthy, good food, movements, very important, rest, and mindful choices. A huge thank you to my incredible guest, as always, Jocelyn Lee, for sharing her wisdom, experience, and heart with us. Her work as a wellness consultant at Arabella Women's Health and Wellness here at Tabitha Medical Center is already changing lives here in Abuja, and I'm proud to partner with her in this mission to guide women toward wholeness, not just weight loss. So to every woman listening, before the jab, ask the right questions. Seek professional guidance. Honor your body. And remember, your health is not just about how you look, but how you live and how you feel every single day. If today's episode spoke to you, share it with a sister, a friend, or someone who needs to hear the truth behind the trend. You can watch full episodes on YouTube, HERcast with Dr. Chito. You can follow us at HERcast Podcast and at Dr. Chito N. You can also watch on Rapid TV, Startimes channel 176, Saturday 7 p.m., Sunday 2 p.m. We're also on all popular podcast platforms, so you can also go there if you're more of the audio kind of person. But anyway, until next time, stay bold, stay beautiful, and stay well. This is HERcast with Dr. Chito. God bless.